Hi, everybody. Welcome to the Pro-Choice Check-In. Thank you so much for being here with us today. For those of you who don't know me, my name is Becca Hart-Holder, and I am the Executive Director of NARAL Pro-Choice Massachusetts. If you joined us 2 weeks ago, we had a great conversation about COVID-19 and gender equality with Senator Markey. If you weren't able to attend, all of our check-ins are available on YouTube, and you can find the link in last week's check-in, the link to last week's check-in in the chat box. A little housekeeping. 2 weeks ago with Senator Markey, we experimented with using Facebook Live. We're doing that again today, so welcome to the folks from Facebook who are joining us. And if you're joining us via Zoom webinar, you might know this part, so grab your coffee or tea. This is a great minute to do that. But just some housekeeping. Because we're in webinar mode, the video and audio feeds are muted for everybody except our panelists. And we've done this because of Zoom bombing. We'd rather see your faces, but we're gonna have a really important conversation and wanted to make the most of our time today. So you'll still be able to interact with us. Kate Freilich, our wonderful membership coordinator, is working behind the scenes to make this experience as interactive as possible. So to the right of your screen, if you're on Zoom, you'll find a chat box. And if you have any technical difficulties, please let us know in the chat box and we will do our best to help you. In the middle of the screen towards the bottom, you'll see a question and answer icon. And if you have any questions for our special guests, you can submit them there. It will save time at the end for a Q&A, and we'll do our very best to get to all the questions. Kate is going to be joining us on screen to facilitate the Q&A session. And just want to remind everybody to follow us on social media. In the chat box, you'll find our links to Facebook, Twitter, and Instagram. It's the best way to stay up to date on future events, upcoming check-ins, important updates and announcements, and just in general about reproductive freedom in Massachusetts. And you can always tweet about the pro-choice check-in using the hashtag pro-choice check-in. So I want to transition to our conversation. And really, I'm so grateful that our two panelists are here with us today. So as you heard in the conversation with Senator Markey 2 weeks ago, NARAL Pro-Choice Massachusetts is really thinking about how to work to be better allies by echoing the Black community's demands for justice and really echoing the demands for maternal justice as part of our work to protect reproductive freedom. The systemic racism that exists in this country is really shockingly evident when you look at racial disparities in maternal health outcomes. And in Massachusetts, a Black woman is twice as likely to die as a result of pregnancy-related causes than a white woman. That's a pretty shocking statistic if you think about it. In Massachusetts, the color of your skin puts you at greater risk of death if you choose to become a parent. It's intolerable and it has to change. And I do want to make a plug really quickly for a NPR story from December 2017 that was really a light bulb moment for me, an expose about the racial disparities in maternal mortality. We can put that link in the chat box, but it's really shocking and it has to change. We thankfully have leaders who've long been calling for action to solve this crisis. And we're going to talk generally today about maternal justice and one piece of legislation in particular before the Massachusetts legislature called an act to reduce racial disparities in maternal health. If it's passed, the legislation would create a commission that will identify the causes of maternal health disparities in Massachusetts and issue policy recommendations to the state legislature within a year. So here to discuss racial disparities in maternal health outcomes, as well as the legislation, are State Representative Liz Miranda and Dr. Ndidiamaka Amutah-Onukagha. So grateful to have you both here. I'll just quickly read your bios because they're both so impressive and it's worth hearing, and then we'll just dive into our conversation. So Rep. Miranda is a first-generation Cape Verdean American and a lifelong resident of Roxbury, the district that she represents. She's an activist, an educator, a nonprofit executive, and a legislator. She's dedicated herself to advocating for her community by using social innovation to drive change. She was elected to represent the 5th Suffolk District in the Massachusetts House in 2018, and really, really quickly established herself as a champion for social justice and a leader on a host of issues, including gun violence prevention, criminal justice reform, environmental justice, education, and maternal health justice. And she's one of the lead sponsors of the bill that we're talking about today, and we're so grateful to have her here today. Thank you, Rep. Miranda. Dr. Amutah-Onukagha is an associate professor at Tufts University School of Medicine and a member of the National Women's Health Network Board of Directors. Her current research interests include maternal mortality and morbidity, health disparities, reproductive health, infant mortality, and HIV/AIDS in women of color. Since 2018, she has planned and led a national conference on Black maternal health inequities right here in Boston that brings together hundreds of healthcare professionals, community health workers, doulas, students, and activists. And with her co-chairs, she provides strategic vision and leadership for the conference and related community-focused activities to ensure that the voices of women of color are centered and amplified in the crisis of maternal mortality and morbidity in Boston and nationally. So thank you so much today to both of you for joining us. I really appreciate you making time in your busy schedules to have this conversation. So I just wanted to start on a kind of more personal note, just by recognizing that this is a really difficult time for all of us. And I know that even kind of talking about how hard it is can be exhausting. So I wanted to start with a question about self-care and just what you're doing right now that brings a little light into your life and how you're caring for yourselves.
It's really interesting. It's a really honor to be among so many. I've been calling us the Punani Power Rangers, you know, like everyone has been, hope that was appropriate, but the idea of just women at front, centering our voices, fighting for equity and justice in all things. This moment is a heavy time. As a legislator, I'm also looking at use of force and how we can change the structural racism that has been here for 401 years and do it quickly, and trying to figure out how we do policing. And so this question of self-care, I'm still struggling. I have found that I invest in community care a lot when I am struggling with my own care. But music, it is Black Music Month, and I think music has been able to help me get through really dark times. And then seeing, just resting, trying to get more sleep have been the two things that I have tried to incorporate into my regimen recently.
Good afternoon, everyone. It's such a pleasure to be here, particularly with Rep. Miranda, who I've been fangirling about you since I moved to Boston. So self-care, for me, I've been trying to definitely get more exercise. I mean, the only upside to COVID has been that all my travel is canceled and I'm home. So shout out to Dorchester, Lower Mills, where I live. I do a 2-mile loop in the morning with hubby, and then I like ice cream. And so I've been trying to not go too crazy on that, but I will get some ice cream if I need it. And then also just trying to be still. There's so many things happening and there's so much going on in the world that trying to find moments to be reflective and to meditate, and also to be thankful for the things that I have in my life. My beautiful toddler who can probably bust in at any time. He's 14 months, and I'm thankful for that, and he brings me a lot of joy. So he's probably the biggest part of my self-care.
You're in a safe space for kids busting in. My kids have done that a whole bunch of times on these and other videos, so don't worry about that.
Thank you.
So I wanted to start with you, Dr. Amutah-Onukagha, and just ask you to give us an overview of the crisis facing Black mothers, both in Massachusetts and nationally.
Sure. So, for those of you who may not be as steeped in the work of the day-to-day looking at maternal mortality and morbidity, I just want to start off with a really stark statistic that Black women are 243% more likely to die from pregnancy-related complications than their white counterparts. And that statistic, I mean, I can never say it enough. I can never say it loudly enough, but it always just kind of hits me because it just speaks to the magnitude of the inequity. But more specifically, in the United States, the rates of maternal mortality among Black women are almost 4 times higher than that of non-Hispanic white women. And thinking about a place like Massachusetts, which, yes, has some of the lowest rates in the country, still persistent racial disparities are here. And also in Massachusetts, in Black women, we saw that from 1998 to 2013, they had twice the rate of SMM, or what we call severe maternal morbidity, which includes, which is a near miss, right? So if a woman is experiencing an SMM situation, it could very easily be a maternal death. And so we see that there are still disparities around that, particularly around blood transfusion during hospitalization. And then also framing the case here in Massachusetts, Black women were twice as likely to experience a pregnancy-related death and a complication as compared to their white counterparts. And thinking about the role of insurance, when you're comparing to women that have private health insurance, women here that are on mass health were almost 3 times as likely to experience a pregnancy associated death. And we know that thinking about the rates for Boston, right? Even after you control for age, for educational attainment, the rates of low birth weight, of preterm birth we see among Black women is still 50% higher than among white women. And we know that there's a concentration of this as a result of residential segregation, racial discrimination in places like Dorchester, Mattapan, Roxbury, which have the highest rates of low birth weight, preterm birth, and maternal deaths in the city. And so, although we're seeing overall reductions in some of these in other parts of the state and in other parts of the country, we're not seeing that in places where we see huge residential segregation and racial inequity, such as a place like Boston and in a state like Massachusetts. So, the framing of that is really important because the rates overall would give cause for celebration, but there really is none. Because when you unpack it and you disaggregate it by race, we still see that Black women are disproportionately burdened in the cases of mortality.
And could you talk a little bit about a term that I learned recently and didn't know, which is weathering, and the impact that it has on maternal mortality and morbidity among Black women?
Sure. So I use weathering a lot in my dissertation, which I can't believe I have my PhD for 10 years now. I feel like I just graduated. But 10 years ago, and just to tell you that we have not moved the needle, which is the other sobering part of it, right? Because I was citing weathering in 2010. So the term weathering was coined by Dr. Arlene Geronimus. She's a professor at the University of Michigan. And she looked at the physiologic response to racism that Black women experience. And so when you take Black women, the cumulative impact of stress, discrimination, racism, Black women are physiologically older than their white counterparts by 5 to 7 years. So weathering describes the continued weathered response to the body regarding cortisol, allostatic load, increased blood pressure, and what that means for placing Black women at increased risk of preterm birth, maternal mortality, and infant mortality. And so it's the cumulative impact, just thinking about like how a house gets weathered by the rain. You just keep beating on that roof, and then over time, what happens, it starts to erode the material of the house, and then things happen. And so it's the same thing with the body, although it's exacerbated and it's actually sped up by the impact of racism and discrimination. So Black women are 5 to 7 years older physiologically than their white counterparts.
Miranda, can you talk a little bit about how you've seen these disparities manifest themselves in the community that you represent? Oh, you're muted.
I try to protect myself, all the people that have their mutes not on and talk about things on the call. And, I can really start personally. And I've lived in the Fitz-Suffolk district my entire life. It is the part of Roxbury and Dorchester that when I got to college was the poorest in the Commonwealth of Massachusetts. I now am the legislator for this community, and it is the most minority district in the state. It's 94% of color, 50% or more foreign born, 62% female head of household. We are a community that went through decades of environmental degradation. We have 5 times the asthma rate. We're dying 30 to 33 years quicker than our neighbors in the Back Bay, just a short bus ride away on the one bus. And in my whole life, I didn't realize, I couldn't name it, that this was happening in my community. My sister, my youngest sister gave birth to a child who didn't survive. My mom had essentially 3 recommended C-sections. My best friend had to basically liquidate her bank account to be able to afford a doula as she was going through her pregnancy alone. Another good friend almost died while giving birth to her child in 2019. And so I've had a lifetime of seeing what poverty does to communities in every area of public health, but I never really could name it until I got into the State House. And March of Dimes did this presentation that looked at the Commonwealth of Massachusetts and literally told me that my community was facing some of the worst outcomes in the Commonwealth. And I was like, here I go again with another thing stacked against women, particularly Black women, immigrant women, marginalized low-income women, who we are living in the city that has the best medical institutions in the world. And so I sat there and I said, you know, I have a Wellesley degree. My mom didn't graduate from high school, but here I was. I did well for myself economically, and still my chances of dying while in childbirth or having a child that didn't go to term or had low birth rate was the same as my mom, who was a recent immigrant to this country in 1975. And so what's happened in our community is that the needle has not moved. In fact, access has probably gotten even worse. And we see an epidemic that is happening in our Commonwealth. In Massachusetts, we do a really good job of patting ourselves on the back because we usually have lower rates of gun death, lower rates of maternal deaths. But for the women who live in those communities and the families that have to survive without their loved ones, those figures don't really mean anything if we're still dying here in the Commonwealth.
I just want to say how much I appreciate you putting that in such real and stark terms. I think it's so important to hear the lived experience of people and just notice that you are doing that all the time on Twitter and on Facebook, and really appreciate you doing that here as well. Could you give us an overview of the legislation? I think it would be great for folks listening to kind of understand what the legislation would do and where it is in the legislature right now.
So I want to say three quick things, and hopefully someone can place the legislation maybe in the chat. I find that to be incredibly helpful. Most people that know something about politics, and this is new to me because I came into the legislature as a community activist and a youth worker. We need more people like that in politics, and really didn't understand like the role of government, the inner workings, but just knew that representation really mattered. That with only one Black woman in 2018 in the entire legislature of 200 members, I knew she needed company. And so now we've had 300% growth. And so there are 3 of us and one person of mixed heritage as a woman of color. And when we add our Asian sisters, there's 6 of us. And so we know that commissions, normally folks say, well, commissions are not critically important. But in this case, commissions are incredibly important, and the legislation is really about forming a commission of the brightest minds in our state to study. We have a lot of national data and a lot of national reporting. We have the statistics. We have Black Mamas Matters and Mamas Con Poder and H&. Song and these fabulous organizations. But in Massachusetts, we wanted to take a closer look. And the commission is a great place to do that. And so we're excited to announce that it was voted favorably out of committee. And for a freshman legislator, or I should say first year legislator, I was elated that we had done so much work in this term to raise the awareness about the crisis that is happening in our country, only to be compounded by COVID and the constant trauma of police hostility and incarceration that many of the women in our communities know all too well, including myself. And so the goal is that we will be voting on this and putting some dollars toward this so that the commission can begin its work immediately to join and build and get some resources and some recommendations to the legislature. And I hope before a year is over, because this is an urgent matter. I can't stress enough that oftentimes when people finally realize there's a problem, they take their sweet time to carry on the mission. When we as women of colors or people who are allies in the field know that this is an urgent matter, not one more woman needs to die in this state or in this country for us to act. And so in the pieces of the legislature, you'll see the bill number. I just want to share a couple of things. I can't share my screen at the moment, but the goal is that we also have commissioners and folks who can give advice and guidance like NARAL and other organizations to those commissioners, so that it is women of color and women are front and center to the messaging and the recommendations that we hope to give to the legislature.
Yeah, I want to really amplify that point. You know, one of the reasons that NARAL worked to support this commission is because, you know, even though I think the legislature, you know, could pass a bill tomorrow that sort of has legislative fixes on maternal mortality and morbidity for women of color, and particularly Black women, the legislature is overwhelmingly white, and many of the advocates in the reproductive health space or in the reproductive rights space are also white. And we really felt strongly that we had to center the voices of women of color. We needed experts. We needed people from the community who, and people who are expert who could really, you know, spend a year saying, these are the legislative fixes. This is the money that we need to fix this problem. And it is going to require holding the, you know, legislature's kind of collective feet to the fire in a year to say, you know, once the commission has made its recommendations, we have to move, and we have to move fast, because there isn't time. You know, even one death is too many. So,
and I'll add, if I could add one piece, that, you know, when I started, you know, my family's deeply Catholic, my community is mostly immigrant. And when I got to the State House, I was like this big pro-choice champion, and I looked around, and I think I could speak for many Black women, and felt like our white sisters had left us behind when talking about reproductive rights, that they were, you know, following sort of the marching orders to protect women's and their right. But when our government went against Muslims or went against Black people, that we found that we were not sort of being, the totality of who we was not being addressed. And so I was committed to join the fight for reproductive rights, but also expanding that there's work to be done in this space as well, to open the door for women of color. And that's why I thought the commission would be a great way to look at the continuum of reproductive rights for women in the Commonwealth. And so, sorry to cut you off on that, but no, I just wanted to share that was a driving force.
Yeah, I appreciate that. Dr. Amutah-Onukagha, could you talk a little bit, just from your expertise, about what are some of the policy recommendations that you would expect to come out of a commission like that? I think all of us are well, I'll speak for myself. I'm really hungry to know what we can do from a legislative perspective. How can we take steps to fix this?
So for me, I think an approach that we should take, for first of all, Representative Miranda, this is amazing, and thank you for your leadership on this. I think we should take the approach that includes both clinical and non-clinical outcomes from the legislation. So what do I mean by that? We know the clinical indicators that reduce the likelihood of maternal death, and these are related to maternal safety bundles. So there are a ton of bundles that are out there from AIM, and we know the Penguin from Massachusetts is working on these things. But in addition to that, we should be implementing hypertension, hemorrhage, racial disparities bundles, right? So you have the clinical components, and then you have the non-clinical components about respectful maternity care. Even as recently as 2017, 22% of Black women reported discrimination when going to the doctor. I think that number is grossly underreported. I think it's probably higher to 50 or 60%. But at the end of the day, the outcomes that I would like to see from this commission should include policies that are both clinical and non-clinical. When I talk about the non-clinical, I'm highlighting and lifting up care and policies that include culturally competent, culturally congruent care, safe care, high quality care, respectful care, policies that examine and unpack structural inequality and discrimination that include those components, and then policies that raise income, build wealth, provide access to clean, safe, affordable housing, improve the quality of education, provide reliable public transportation to medical appointments and to healthcare facilities. And also, introduce the affordability and availability of healthy food. So we're talking about policies that really encompass the social determinants of health, and we're talking about providing women with the best, highest quality, equitable, respectful maternal care that we can, with an understanding of the clinical components and what really happens in the delivery and the postpartum period from a clinical perspective.
How does mass health coverage of doulas figure into this conversation?
I think doulas are huge, and we should definitely, the doula bill I know is moving as well, and so I would definitely like to defer to my colleagues. Shout out to Accompany Doula Care, Christina Gable, who's been amazing in lifting up this work. But I think doulas are an absolutely necessary part of the care team for women, for Black women. I had a doula in my recent delivery, and she made a huge difference. And I think that doulas, the research says, so if you don't want to talk about it from an anecdotal perspective, okay, fine, as a new mom, there's tons of research that supports the benefits of doulas in the pregnancy, delivery, and postpartum period. And we know that culturally congruent doulas that are able to advocate for their patients, that are able to serve as liaisons between their patients to make sure that their birthing plans are respected, that women are not getting forced C-sections, women are not being having their bodies invaded unnecessarily without notice, without instructions, all this really violent things that we see that happen to women. Doulas have really, really been able to mitigate that. And so the doula legislation that is happening, the work of Mass Health around this is huge, and I think it's long overdue in a place like Massachusetts.
Miranda, you, I think, were alluding to in your conversation or in your remarks earlier, maternal justice, which I know for some people is kind of a new term. And you've already started to do this, but I'd kind of love to hear you talk a little bit more about what maternal justice means to you. And of course, Dr. Amutah-Onukagha, I'd love to have you add in at the end as well.
One of the things that was clear, I'm also the co-filer of the doula bill, and I just want to let everyone know that there is commitment from all the filers to basically push a maternal justice agenda of the doula care bill, the disparities bill, and the midwives bill, and let the whole legislature know that we are focused on this and unified, that we cannot only do one thing in this moment, that COVID, racial justice initiatives, and the idea of fighting for maternal justice are intricately linked. And we have a situation that outcomes are getting poorer, and we want to make sure that if we're going to do it anytime, we're going to do it now. And so I wanted to share that with folks, and folks can share that legislation. It's been edited, and it's still not completely edited on the Mass Legislature page, so I'll be sure to share that with folks at NARAL, and they'll get that out to folks. We know that doulas help change lives because they are not listening. And I mean they, as in providers, insurance companies, families, are not listening to Black women. In society, there's this notion that Black women can handle a lot of pain. And even as recently as last year, there was a story of a young 27-year-old mother who died after visiting the best hospital in Rhode Island, screaming of pain, and they sent her home. And the fight for justice around Kira and her family that has had to live on without her, we know that maternal justice is essentially the fight for centering mothers or birthing people in their own wellness. And we know that if folks are not listening, we know that they need help. And so I really see maternal justice as another form of us fighting for equity and justice in another sector and system that has not been created for us. We heard from a lot of doctors and midwives and doulas and parents who said, in my care, I was looked down upon because I was a single mom or a teen mom, or I couldn't speak good English, or I didn't have access to a high quality facility here in my community. We've just heard recently, both in the western part of the state and in Brockton in the South Shore, that they're closing down facilities. And so if you are a mother in distress or someone who's birthing in distress, and you have to have a 45-minute ride, and you might not drive, and there might not be good public transportation, that these other social inequities also impact how you can give birth. And so we want to make sure that the journeys of women are also understood to be impacted by our housing, by our economic, the wealth disparities that we face, by our education. And, sharing this with my colleagues has been a very interesting thing, because no one wants children to die or folks that are having children to die, right? And so there's like this moment that is like, surely it's not racism, right? Surely it's other factors. And when you have a system that has not changed, regardless of zip code, regardless of class, regardless of education, regardless if you have a partner in the home, then we can only look towards structural and systemic racism as the driver for many of the inequities that are leading to Black women dying in this country.
Mm-hmm. Anything you want to add, Doctor?
Yeah, thank you so much, Liz. What Rep. Miranda is describing is what we call in the research a maternity desert. So what we see happening very systematically in the South Shore and in the western part of the state has also happened in my hometown of Trenton, New Jersey. The hospitals that I was born in, all my siblings were born in, they no longer have OB units. And so women, actually my goddaughter's mom who was high risk and had placenta previa and almost died from hemorrhage, had to find a ride or an ambulance to get there. And then she was billed for the ambulance, which was like 45 minutes away. So these maternity deserts, we know, are not specific to Massachusetts, although we do see an exacerbation here. It's happening in pockets all over the country. I'm doing work in my home state of New Jersey. I'm doing work in DC. We're seeing the same thing. And so these maternity deserts, again, if you have the resources, right? Like I recently had a child. I'd hop in an Uber, go do my appointments, have lunch. It was like a half-day thing for me. Nobody's looking for me in the office. I'm not on the clock. I have money to do an Uber ride to and from the facility. I'm kicking it with my OB. Shout out to Dr. Audra Meadows. And it was quite the stress-free experience, and that's why I think I've had such great pregnancy and postpartum outcomes. We don't see that happening in other communities, and we definitely don't see it for Black women overall. And so I definitely want to emphasize Liz's definition of maternity justice. I think it's amazing. I think that is a huge platform. I also do a lot of work around reproductive justice, right? Like the decision to parent safe. I'm going to give you guys a formal definition from Sister Song. I don't want to mince their words. So shout out to Sister Song. But they define reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we do have in a safe and sustainable community. And that's really what this is about, right? The equal justice, the reproductive justice, the maternal justice is about giving all parents or people that choose to have children the opportunity to parent in a safe and sustainable environment. And so the maternity deserts that we're seeing across the state require immediate response and action because we know we're going to see an increase in maternal deaths and severe misses. Women need to get to the hospital in a reasonable amount of time. They need to have birthing facilities close to them. This also lays the foundation for the work of birth centers, like the work that Nashira Burrell is doing with the Neighborhood Birth Center here in Boston. Shout out to Nashira. This is work that is centering women, and this is work that is necessary. And so when you have these opportunities, you see the political, you see the economic will that is shutting down birthing facilities. Look at the communities that are being adversely impacted and tell me if this would fly in other communities. It wouldn't. There would be an uproar. And so we need to do more about addressing these maternity deserts, and that work is all steeped in maternal justice and reproductive justice. So.
Yeah, I wanted to give just a little bit of specifics to something that you said, Rep. Miranda, which is that, and correct me if I'm wrong on this, but that recently the entire midwifery unit was shut down at Holyoke Hospital. And, you know, we know that I had a midwife, I'm a big proponent of midwives. I love midwives. And we know that they have really positive outcomes, birth outcomes for people of color. So I think, you know, it's really shocking to think about these maternity deserts, especially when you're a pregnant person, you are already so vulnerable. You are already at higher risk for many other complications with your health and your well-being. But to think that, you know, it's 45 minutes or an hour to your you know, healthcare provider, and you know, that person might not be taking your concerns seriously even when you get there. It's I mean, I just keep coming back to that 243% number. It's shocking, and you know, we have to move this bill, and we have to have the commission meet and have their recommendations adopted. There is just no time to wait.
Yeah, you know, I would say that the hope that I, you know, feel right now, even though people have been saying, well, how do you stay hopeful? Like your community went through so much with COVID, your own family, then you have these issues, these hot button issues, immigration, maternal justice, EJ, police brutality. And I said that the hope is that we actually have some people that can get it done in the legislature. We just have to remember that everything is political. And so I share this a lot in my inner city community, because people have really sort of torn relationships with government and those that are meant to protect and serve them. And I share with them that the power is really in your voice to inform public policy by changing the discussion with public opinion. Right? So I'm gonna give people the benefit of the doubt that some people just don't know this exists because they live in a bubble. They might live in a community that is healthy, that is safe. They've got lots of trees. They're not overly policed. They have really great health centers, and they know their doctors really well, and there's no racism. They think everything's perfect. But those of us that live in communities where everything is the opposite of that, we live with this trauma every day, knowing that we have to address something very quickly. And so we can really join forces, and that's what the call was before I actually got on here today, to say to Representative Khan, to Senator Rausch, who I'm working on this disparity bill with, to say, let's connect with Speaker Pro Tem Pat Haddad and Rep Sabadosa. Let's connect NARAL, March of Dimes, the hundreds of doulas and midwives and folks who've had children who have informed our legislation, and say, let's get this army started. We're not gonna change Massachusetts. We're not gonna change the structure of racial inequality without doing this together. This is for us to say, we need doulas, we need this commission, we need more midwives, we need to make this affordable and accessible, and to let them know, how do you remove a whole wing out of a hospital in one of the poorest communities in our state? You are turning your back on a whole host of people, and women will die. Women will not get the care, babies will die. And folks who are going through this journey with their partners are gonna say, how could we let this happen in Massachusetts? And so that's what we're up against currently in the Commonwealth. So thank you for sharing all that stuff, Doctor, because we're in this together.
So Rep, oh, I'm sorry, I didn't mean to cut you off. Go ahead.
No, I was just going to say absolutely, yes.
So Rep, you know, people become members of NARAL Pro-Choice Massachusetts because they want to make change in the world. So what can we do? What can our supporters do right now to get this bill passed and signed into law?
One of the most important things you can do is, if you're in a community that you don't have one of these representatives that are pushing this agenda, is to say to them, this matters. And so I've already seen sort of the communications online, and I already got 3 emails today, so I'm super excited. But they need to hear from you, and they need to hear from you not only through an email, a phone call, or a letter, but you need to push them on air, on Twitter, to have them have this discussion that, do you know that this is happening in Massachusetts? I am a voter. I'm a person who cares deeply about justice and equity, and we want you to do something about it. And so I encourage you to vote for this or to push this legislation. The second thing is to inform your people, right? You know, we have a lot of influence in our sphere of influence where we go to church or not go to church, or where we go to home, our alumni associations, the people you go to lunch with. The doctor had talked about, you know, I was like grabbing lunch. We can help inform the people around us to help us join in this fight. And so I find those to be the two most important things you can do, is to push the legislature, push public opinion, and use our sphere of influence to make a difference. And in this moment in time where racial justice is being discussed, America has had 401 years when its founding happened for us to get a lot of things right. We've gotten a lot of things wrong. And in this moment where we're elevating racial justice and structural racism, I think it's important to elevate this conversation right along it. It's not the only place that needs to be defunded is policing. It's, you know, our hospitals do not pay or invest in their communities in the ways that they should. There's both implicit bias training and explicit bias training that needs to be happening in our large institutions, from nonprofits to the criminal justice system, to our courts and our hospitals, or where we get care. So if those three things are in your periphery of possibility, I would say that do them. You know, educate those around you, push the legislature, raise awareness online to make sure that we do this year. I am very scared that if we don't do it this year, then I don't know if there'll be another moment so the sense that it can happen. The sense of urgency is definitely at my foot and my head right now about us pushing this now.
I want to be mindful of time and open up the conversation to questions, but just before that, Rep. Miranda, I really believe that the fight for racial justice and reproductive justice are intertwined, that all our liberation is intertwined. And I just want to give you a minute or two to talk about the work that you're doing on the kind of force that police can use against members of the public. I think it's a really important, it's a really important part of this conversation. So I'd just love to give you that space.
Great. So most people saw the news that a couple weeks ago, a bunch of electeds of color joined the Black and Latino caucus, for which I'm a member, around a 10-point plan or strategy, really for short-term support around addressing what is happening around the nation, but also happening here in Massachusetts. Many of the policies that reduce interaction with police that turn out adverse or lead to bodily harm or death, we in Massachusetts are also struggling with. And so a bunch of my colleagues filed things like qualified immunity, addressing the fact that police have sort of access to folks to litigate for them, and they're protected. Folks have created a post-commission bill. You hear a lot about that, around decertifying, certifying, and increasing training for officers. There are 351 towns in the city, in the state, cities and towns, and every department does things differently. 61 towns and cities actually rely on the state police for their policing. And so therefore, we need to make a change in all forms of law enforcement. I filed an act to save Black lives and transform public safety. 5128 is the docket number, because I want to save people. And Breonna Taylor, who was an EMT, had an officer who performed a no-knock warrant, came into her home and shot her while she was sleeping. That is not policing. And so I want to end no-knock warrants in Massachusetts. I want to end tear gas. Tear gas is seen a crime of war. And when you're in combat, I don't think it belongs on our city streets. I want to end rubber bullets. Rubber bullets have killed people in the line of duty while folks are trying to get to protest. And I believe that we can do something. Lastly, there are other elements of the bill that I have a summary that I can share, but making police misconduct records public is an incredibly important thing. We are one of 35, I think, or 36 states that do not make police misconduct records public. Therefore, folks who have been committing crimes, bad officers, you hear a lot of law enforcement talk about bad actors, are getting jobs in the criminal justice system in Massachusetts and in other states because their records are not following them. There's no police misconduct query that is impacting them. And I do believe children are watching their parents be killed. Partners are watching their loved ones be killed. And therefore, we cannot fight for maternal justice without looking at who we're killing in this country, because it's disproportionately Black and brown men and women and trans folks who we are impacting. And they have families and stories and loved ones too, and we have to fight for that. So I hope that you guys will join me in this intricate and this combined and intertwined fight, that if we want to save lives, we have to do a bunch of things at the same time. And yes, we're tired. Yes, we're emotional. Yes, we're angry, but I know that it's possible.
I appreciate always kind of ending on an uplifting note, and I appreciate you reminding us that this is possible. This is possible. We can make these changes, and we're not going to stop until we do. I'm going to ask my colleague Kate to come on. I've given a little bit of short shrift to the folks asking questions, and I apologize for that. It's such an important conversation. So Kate, a couple of questions for you to throw out, please.
Yeah, hi. Thank you both for sharing so much, so many wonderful things with us today. Our first question is, we know that pregnant and parenting teens of color face unique barriers, and wondering what is being done and can be done specifically to connect with them. And Dr. Amutah-Onukagha, that's specifically to you.
I think there's a lot that can be done. I actually, there's a couple organizations and coalitions that are addressing this. So one of them, I have to give a nod to the Community Action Network that is housed within the Boston Public Health Commission. Also, we have the great work of ABCD and their Director of Health Services, Irving Goldson. There's a lot of resources being put into addressing their needs, but I think we could actually do a lot more. And so I think I would just defer to the people that are working in communities of color with adolescents of color. There's also the Youth Risk Resilience Program, also housed at the BPHC. So there's some resources there, and I'm happy to connect people offline if they need to.
I'll just add one, which is a colleague named Lisette Gil-Sanchez runs at DPH, runs a really amazing project for pregnant and parenting teens. She's doing incredibly important work, and wanted to lift that up.
Wonderful.
Thank you. Rep. Miranda, this is a question for you, but I think you can both answer this. Why is it important that this commission the bill would create is done by the state and not a university or other standalone research institution?
One, there's room for intellectuals and researchers to join the Commonwealth in discussing this, but the reason why is because we have to change state law. One thing that's really important is that government's incredibly important, and there's already work happening at institutions. I think about some of the work that's happened at Tufts, at Harvard, and other institutions to really bring light to this pandemic within a pandemic. But one of the things we want to make sure is we change the statute, make the law more supportive, and have them understand that the things that they're doing or have done in the history of our government, which started in 1636, that is actually impacting different groups of people. And if you know anything about our government starting, it didn't include us, right? If you weren't a white, male, Protestant, wealthy landowner, you wouldn't have been part of the conversation around the sort of ideals of the forming of America. And so for me, it's incredibly important that other work be done and continue to be done in those spaces, but I would love to bring all those spaces into this commission. And the good thing about a commission is that when it's driven by people who are dedicated to the cause, it's also flexible and open for as many voices to join. So although there'll be commissioners from different organizations leading this, the meetings are public, the advisory boards are public, and so therefore there's an opportunity to really be informed by more people, and it will have an impact on lots of sectors and lots of fields with the recommendations, who will look to the government as a leader to make a difference. So that's how I look at why this commission is happening here, because it's only one solution out of many that needs to be done. I hope I answered the question, right?
Yeah, no, that was a great answer. I think we have one more question. Sorry, they're next to me, so I looked over. For someone just learning about these inequities in maternal health outcomes, would either of you recommend a resource as a starting point, someone to look to? We're looking forward to circulating resources with those on the call after this, but where's a good starting point?
I can suggest some books and some readings. There's a couple of people that have been publishing about this for a long time. A couple of books that I think people could use to ground themselves are one, Killing the Black Body. Another book, that's by Dorothy Roberts. Another book, oh my gosh, Medical Apartheid by Harriet Washington. That's another good book. And then as far as like experts in the field, the work of Dr. Elizabeth Howell at Mount Sinai has been really, really seminal in this space. Also, the early work of people like Dr. Mani Noor-Jeter, who looked at racism and birth outcomes. She has a seminal paper called It's the Skin You're In. It's a little old now, but it's still quite relevant. And her new name is now Dr. Amani Allen. She's at Berkeley. Dr. Dara Mendez and I have published extensively on this as well. So I think there's a lot that you can look to. And for people that are more like the TEDx style, you can always go to Dr. Kamara Jones and her Allegory of Racism. That's a really grounding piece I use a lot in my class. Also the work of Dr. Kimberly Crenshaw on intersectionality. So there's tons out there. And I think that you just have to start looking and you'll come across something that is digestible for you.
We'll follow up for folks that signed up for this and send out a list of some of those resources. I appreciate you naming those. And I am also going to put in the chat a link to a story from December of 2017 from NPR about a woman named Shalon Irvings who died shortly after, I think it was 3 weeks after giving birth. She was a CDC expert researcher who studied health disparities among people of color.
She was my friend.
Was she? Oh,
yeah,
I'm
we
so
did our
sorry for
postdoc
your
together
loss.
in Baltimore.
I'm sorry. That she was. She sounds like she was an absolutely amazing woman.
She was.
And
and she always wanted to be a mother. She always wanted to be a mother, even when we were in school.
That piece is, I just on a personal note, I heard that piece on the radio 3 weeks after my son was born. And so it was the moment in my life that I really realized how unequal it was in terms of pregnancy outcomes. And I'm sorry that it took that long for me to realize it. So I want to be mindful of everybody's time. You both have been so generous with us, giving us a whole hour of our time to listen and learn from you. Thank you for that. I just want to reiterate that, at NARAL Pro-Choice Massachusetts, we believe that anyone who wants to be a parent has to have the ability to safely bring children into this world and to parent as they see fit. But, it's really obvious, if it wasn't before, it certainly is right now in this moment, that systemic racism have denied Black communities the ability to safely start and raise families with sustainability. So we are deeply committed to making the change that this bill contemplates, and we are fighting for this commission to pass. And we feel really strongly that when the commission makes its recommendations, because I am going to believe that this is the moment that it passes, that it is incumbent on our organization to really push for the reforms that the commission recommends to be enacted into law. We simply can't wait. So thank you both so much. I'm so grateful for your time. Just a few quick volunteer announcements before we go. This Thursday, we're hosting another virtual movie night. We're screening Moonlight. You can sign up at the link in the chat box. And next Tuesday, the Roe Act Coalition will be hosting an abortion access conversation. If you've been to those before, they are really interesting, great evenings. And this one is on the intersection of abortion access and LGBTQIA issues. A link will be available also in the sign up. And you can volunteer for our you can RSVP for our June volunteer meeting, which is taking place on June 24th. Thank you both so much for making time to join us this afternoon. I hope you have a great rest of your day, and thank you for spending this hour with us.